Thank you for staying with us on Consider This. I'm Melisa Idris with Dr. Kenneth Simler, better known as Ken, Senior Economist at the World Bank Global Knowledge and Research Hub. Also, Kelvin Cheng, researcher on economics, trade and regional integration at the think tank ISIS Malaysia. So in conclusion, gentlemen, I really want to take a look at what can be done to further improve Bantuan Sara Hidup, right? In which areas do you think Bantuan Sara Hidup can be tweaked so it becomes more effective? Ken, would you like to start?
I'd say when I first started analyzing this, I thought it would be improving the targeting.
Okay.
And after working a lot with household income survey data, doing some quantitative analysis, I'm not convinced it's more the depth, as we were talking about earlier, that it's really the amounts that even if you end up targeting this perfectly to the households at the bottom end of the income distribution, that it's not going to have a bigger impact unless the benefits received are larger. Okay. So you can multiply that effect by having better targeting as well, but the main outcome from our research is that really increasing the level of the benefits.
Increasing the level of benefits. Right. So, as you mentioned, spending more on social safety. You know, one thing that you said before that just kind of struck me, I just thought it sounds like Malaysia is spending quite a bit on cash transfers. In fact, there was a lot of talk about reducing it, or in fact, cancelling the program entirely last year. There was chatter on that. But you're saying we should be spending more, and given the fiscal discipline that Putrajaya is trying to instill, how would you justify that? Say you're in consultation with the government. How would you say, Pakatan Harapan, I think you need to be spending more money on these programs. What would be your justification?
All right, it would be, and I wasn't clear on this before, spending more on BSH, maybe not spending more in total. For example, I mentioned fuel subsidies before, which are untargeted, which are actually regressive, okay? They go mostly to higher income households. They actually exacerbate inequality. There's been a move, I know, to monetize the fuel subsidy, talking about targeting that towards the B40, possibly even having no fuel connection at all, that sum of money go into a top-up to BSH. Okay. And I think that would be a very fruitful way to go.
Okay, wonderful. Okay, thank you for clarifying that. Okay, Kelvin, what about you? What are some of the recommendations that you think can be made to BSH?
Well, Melissa, I think I'm in complete agreement with Ken here that I think we both reach one of the same conclusions, is that BSH benefit size has to be increased. So currently you mentioned that we're spending a lot on BSH benefits, but in fact it's only about, correct me if I'm wrong, but it's only about 0.3% of GDP. When you compare that with international cash transfer programs around the world, typically on average you'd find about 1% of GDP spend, and that's total costs. So there's certainly a lot of room there for an increase. And even if you look at how much the benefits are, like for per household, right? So currently, if you have 2 kids and household income of 2,000 per month and below, you receive about 1,480. And that is only about around 8% of pre-programmed consumption, right? So international evidence suggests that a threshold of about 20% is deemed to be more beneficial, more transformative, and that creates more powerful benefits for poor households,
20%,
right? 20%. So now we're at 8.8%.
Right, that's a significant
amount. I'm not saying we have to go that high, but it just shows how much room we have for that.
To go. And at what point does it become effective? Is that, so you said the threshold is 20%, right?
20% is just, I guess, a sweet spot.
Right, and if you look at other countries, especially Latin America or Europe, you see, including Eastern Central Europe, some 15 to 30% as far as the proportion of total household income that comes from the benefit. But even Thailand has a program of 13%.
Okay. One thing that we didn't touch on is the concept that cash transfers tend to be short-term, right? It is a short-term gap, a stopgap measure in terms of reducing poverty. It doesn't so much address inequality. So it doesn't quite reduce inequality in a country. So cash cannot be the only way to provide social safety, social assistance programs. What other ways should we be thinking about this, Ken?
Okay. Well, on the inequality question, I would say actually in this case it both reduces poverty and reduces inequality.
Okay.
Because because of the targeting, the benefits are going to low-income households and not high-income households. Presumably, the high-income households are paying more taxes than the low-income households that fund the program. So we see both benefiting both in terms of reducing income inequality and reducing income poverty.
So cash transfers, in the long run, help in reducing inequality.
Yes, if they're designed sensibly, which most of them are.
Wonderful. Kelvin?
But I think the international evidence has been moving towards a point where people have been realizing that cash alone is less effective than cash plus, right? So what I'm talking about is like cash plus some other kind of assistance effort that helps to bolster the effects that even make it even greater of an effect than doing either one alone, right? So one thing we've seen is that cash plus supply side investment in education and health infrastructure, and that certainly has very powerful effects than doing either one alone.
Okay, so also looking at the entire ecosystem in terms of fixing, I guess, the fundamental issues within the country. Well, gentlemen, thank you so much for sharing your thoughts with us today. It's been a real pleasure discussing Bantuan Sara Hidup, and I have to say, you've changed my mind in the way I've been thinking about these cash transfer programs. Perhaps we'll keep this conversation going, making sure that our social assistance programs are, I guess, going to the people who need it the most. You've been watching Consider This. I'm Melisa Idris, and I will be back with you same time tomorrow. Make sure you catch me then. Thank you, guys.
Thank you very much.
Thank you for that. Thank you.
Thanks.
Thanks.